If one were to hop on I-35 or I-235 and travel north about 15 miles from downtown Oklahoma City, they would find themselves in the town of Edmond, Oklahoma. Edmond first got its beginnings as a coal and watering station for three major railways during the 1880s that came through the Oklahoma Territory. Edmond is home to many firsts: the first church, the first territorial schoolhouse, and the first continuous newspaper. Edmond got its name after a man called Edmund Burdick, who was a railway agent for those railway companies. The population of Edmond is approximately 94,000 people, which is a 37.7% increase since the year 2000, and the population only continues to grow. After completing the community assessment, it is evident that there are two major community factors that contribute to the community health issues in Edmond. The first factor is the city's emergency preparedness procedures. There are many homes in the city that do not have tornado shelters. Since Edmond is an older city, only newly constructed homes have tornado shelters. Families who live in older homes can pay to have shelters placed within their homes, but that cost is high. It is also difficult to hear the tornado sirens in some parts of the city, especially when there is a storm occurring and the environment is loud. Another factor that contributes to the increased cancer rates is the number of gas stations, vape shops, and dispensaries located in Edmond. The number of adults in Edmond that smoke is about 19%, and the number of high school students that smoke is about 9%. Not only does this contribute to the cancer rate, but also an increased rate of heart disease. In addition to readily available resources that cause cancer, most residents in the city of Edmond drive their own vehicles. This contributes to poor air quality, which can cause cancer. Access to care is available, as there are many hospitals, clinics, and doctor's offices in the area. However, the cost of that care is 18% above the national average, which can make access to care difficult. My nursing diagnoses for these two problems are risk for decreased quality of life amongst Edmond residents related to increased tornadic activity as evidenced by insufficient emergency preparedness measures, and risk for increased rates of cancer deaths amongst Edmond residents related to air quality and cigarette use as evidenced by increased cancer risk in Edmond. For the nursing diagnosis of risk for decreased quality of life, a goal would be that Edmond residents will have an emergency preparedness plan that meets city standards by the end of 12 months. And for the nursing diagnosis of risk for increased rates of cancer deaths, a goal would be that Edmond residents will understand the cancer risk associated with cigarette smoking and poor air quality and will be educated on when to be screened for certain cancers by the end of 12 months. Nursing interventions for risk for decreased quality of life, primarily for primary prevention, include that the city will construct a standard for emergency preparedness and distribute it to its residents. Secondary prevention would include that the city of Edmond will survey homes in need of tornado shelters and discuss with residents the payment options for those. And for tertiary prevention, during a storm, residents will receive a loud alert on their phone advising them to seek shelter and a reminder of the important materials needed to gather in that shelter. For the nursing diagnosis of risk for increased rates of cancer deaths, primary prevention strategies would be to educate students in schools and residents of the increased risk of cancer due to cigarette smoking and air pollution. Secondary prevention measures would include community screenings to be held around 4 times a year for smokers and non-smokers to identify those at risk for lung cancer or to identify those who have manifestations of cancer. And tertiary preventions would include educating those who have been identified as having cancer, and resources will be distributed amongst those residents to identify treatment options. To evaluate whether or not my interventions were successful, I would send out a citywide survey to identify if residents have an emergency preparedness plan and describe what it is, and whether a tornado shelter is located within their homes. Another survey would be sent out to residents of Edmond to identify how many residents are still smokers and whether they are receiving regular screenings provided by the community to identify for cancer. Hospital data would also be needed to be analyzed to determine the rate of cancer in the city. By doing these surveys, they would identify whether the community has been properly educated and if the health and quality of life amongst Edmond residents has increased or decreased. My biggest takeaway from this project is that there are many things about Edmond that I didn't know, including just how it got its beginnings. I've lived here for 24 years of life, and I didn't know that there were community health issues that needed to be examined. And so it was very eye-opening and enlightening for me to be able to do this research. I did not know that the air pollution quality in Edmond was increased and has one of the higher air pollution qualities in the state, excuse me. And so it was definitely very interesting for me to be able to analyze my own community where I live and see what the issues are.